is Lindsay. I'm going to be your nurse today. We're going to be doing a physical assessment. Have you ever had one before?
Yeah.
Okay, so you're going to be standing, sitting, and lying down throughout this assessment. Can you tell me your name and date of birth?
Krista Fulkerson, 7/11/96.
And where you were at?
Madisonville Community College.
And who the president is?
Donald Trump.
And the year.
2019.
Patient is alert and oriented ×4. She's alert to herself, where she is, the date, and who the president is. Okay, now I'm just going to do your vital signs. Okay, your blood pressure is 122/80. Now I'm going to check your radial pulse. Okay, your pulse was 80 and your respirations were 20. Now I'm just going to feel over your brachial pulse. Both the radial and brachial are 2+, which is normal. I'm just going to check out your skin. The color is normal to ethnicity. I don't see any bumps, lesions, or masses on the arm. I'm going to check your skin turgor. You have good skin turgor and elasticity. Your cap refill is less than 3 seconds. Just checking it out. Okay. Can you do this for me? Your fine motor skills are intact. Can you squeeze my hands? Muscle strength is grade 5 in your arm or your hands. And then can you push against me and pull back? Muscle strength in your arms is a grade 5. Okay. Can you roll your wrist for me? Okay. Range of motion in the wrist is normal. Can you extend your elbows? Pull back. Go back and up. Okay. Range of motions in arm and shoulder are intact. Okay. Now I'm going to move to your head. Your head is symmetrical to your body. I'm just looking for any bumps or lesions or bugs, and none of those are noted. Hair is evenly distributed. Her hair is brown. Okay. And have you had any pain in your head? No? Okay. Now I'm just going to move down to your ears. Have you had any pain in your ears? No unusual, like anything coming out, oozing? No? Okay. Is that painful?
No.
Alrighty. Tympanic membrane is pearly gray. I don't see any abnormal drainage in the ear canal. No lesions noted on the outside or the inner ear. Now I'm going to feel over your sinuses, so if you just tell me if there's any pain, I'm throwing palpation.
No.
Okay. And then I'm going to hold onto your temporal pulse and feel that. That's a grade 2, and I'm going to do that bilaterally. And it's a grade 2 on both sides. Can you squint your eyes and puff out your cheeks? That's cranial nerve number 7. That tests your facial features. Can you open your jaw? Was there any pain Okay, that's cranial nerve number 5. And then can you swallow? Okay, cranial nerves number 9 and 10 are intact as well. Before I do your nose, I'm going to do your eyes. The conjunctiva is pink, the sclera is white, her eyes are brown. Her pupils are 3 millimeters on both sides. They are equal to the face and symmetrical. If you'll just stare ahead for me. Perla is intact. Her pupils are equal, round, reactive to light and accommodation. Can you just stare at this pen? Direct and consensual response is intact. And then now I'm just going to have you follow the pen. And just don't move your head. Cranial nerves 3, 4, and 6 are intact. All external features of the eyes, your eyebrows and eyelashes are evenly distributed. I'm just going to take a look in your mouth, so if you'll just open up. Tonsils are absent. Did you have those removed?
Mm-hmm.
Okay. The hard palate is dark pink. The soft palate is light. I don't see any lesions noted. That you have 30 teeth. Can you lift up your tongue for me? Okay. Underneath the tongue is pink and moist. Can you stick out your tongue? The tongue looks normal. No lesions noted on it as well. She's sticking out her tongue, which is cranial nerve number 12. Okay, just open one more time. All right, no lesions noted. The uvula, can you say ah? It moves on speech. Okay, now I'm gonna look at your nose, so if you'll just look up for me. No deviation in your septum. I don't see any lesions noted. Can you hold on one side of your nose and sniff, and then to the other? Okay. Did you not have any problems doing that? You don't have, there's no drainage or lesions noted. Pink and moist in her mucous membrane. Now I'm just gonna have you close your eyes. And can you tell me what you smell?
Alcohol.
Okay, that tests cranial nerve 1, so that is intact. Okay, now I'm gonna go behind you and I'm gonna whisper a word, and I just need you to tell me and repeat what I say.
Football. Football.
That tests cranial nerve number 8. And now can you breathe in? Okay, chest expansion is normal. We have a ratio of 1 to 2. Now since I'm back here, I'm just going to go ahead and listen to your breath sounds. Okay, no adventitious breath sounds in the posterior part of your lungs. Now I'm going to do the anterior. Okay, no adventitious breath sounds on the front or back, no labored breathing. Now I'm just going to take a look at your neck, so if you'll just look up for me. Your trachea is midline. There's no lesions noted, no masses. Do you have any trouble swallowing, any problems in your neck?
Mm-mm.
No? Okay, now I'm just going to take a look at your nose, your lip nose, okay? This is the preauricular, postauricular, occipital, tonsillar, submental, submandibular, superficial cervical chain, deep cervical chain, posterior cervical chain, and this is the supracervical. And then none of those were palpable, which is normal, so that's a good finding. Okay, and now I'm going to listen to your heart sounds. Okay, right sternal border, second intercostal space is the aortic valve. Left sternal border, second intercostal space is the pulmonic valve. Left sternal border, third intercostal space is the Erb's point. Left sternal border, fourth intercostal space is the tricuspid valve. And then fifth intercostal space midclavicular on the left side is the apical pulse, and I'm going to listen to for 1 minute. Okay, your apical pulse was 79, so that's good, that's normal. I don't notice any masses or lesions on the chest area. No, you said you didn't have any pain noted. Okay, so all of that's good. Now I'm going to move down to your abdomen, so if you don't mind, if you'll just lie down for me. Okay, while you're lying, I'm just going to feel your epitrochlear nodes on your arm. Okay, and those weren't palpable either, which is normal. Have you had any problems with your urination system? Can you tell me when your last bowel movement was?
Yesterday.
Okay, I don't see any pulsations of the stomach. The umbilicus is inverted. The contour is normal, and the color is normal to ethnicity. So now I'm going to go ahead and listen to your bowel sounds. I'm going to start in the right lower quadrant, the right upper, the left upper, and the left lower. And bowel sounds are normal active times 4. I would listen for 5 minutes each. Okay? And so while you're doing this, I'm just going to have you flex out your hip for me. Okay? And then can you pull your knee to your chest? And then roll your ankles. And I would do this bilaterally. So you have full range of motion in your hip, your legs, and your ankles, and your feet, and then your knees because you bent up. Okay, now you can go ahead and sit up for me. Okay, and so you had no pain noted in your stomach. It didn't hurt when I pushed on it, nothing like that. All right. Okay, so now I'm going to put on my gloves. Okay, and can you shrug your shoulders for me? And then do it with resistance. And then roll your neck. Okay, you have full range of motion in your neck. You have full control. Can you push against me? Muscle grade in your neck is a 5+, which is normal. You can shrug your shoulders, so that tests cranial nerve number 11. And then roll up your legs. Hair is evenly distributed on her lower extremities. The color is normal to ethnicity. The hair is evenly distributed. No masses, lesions noted. I'm going to feel up her popliteal pulse. It's a 2+. I'm going to feel up your dorsalis pedis, which is also a 2+, and I'm going to hold on to your posterior tibial. And that is also a 2+. Okay, can you push against my hands, pull back, and then push forward, and then pull with your feet. Muscle strength in legs and feet are a 5+. I'm just going to look at your feet. I'm I'm looking for any masses, lesions, and none are noted. I'm looking at the palms of the feet for any ulcers or anything like that, and that was not noted either. I'm gonna check cap refill on her toes, which is less than 3. And I would do that bilaterally to both feet. I can check her skin turgor on her foot as well, and it was normal, so that's good. And then I'm gonna test your quadriceps reflex. Okay, and quadriceps reflex is intact as well. I think that's all we have for our physical assessment today. Thank you, and I hope you have a great day.
Thank you.